Good afternoon, everyone, and thank you so much for joining us today in this webinar titled Closing the Gaps in Member Experience. Before we go too far, I do want to have a couple of actually logistical items before I introduce the host. The first is please use your GoToWebinar control panel to ask questions throughout. We'll try to get to some at the end of the conversation. And without further ado, I want to introduce you to your hosts for today. On the phone with me, I have Meg Berke, User Experience Designer and Strategist at Medullan. Meg, would you go ahead and tell folks a little bit about yourself?
Yeah, hi everyone and good afternoon. So here at Medullan, I focus both on experience design, but also engagement strategy, and more specifically within engagement strategy, I really look at how organizations can better understand human behavior and complexes to really help drive impactful health outcomes.
Yeah, perfect. Okay, thanks, Meg. And myself, my name is Ryan. I'm the VP of Platform Solutions here at Medullan, responsible for bringing our care experience platform to market. I've been with Medullan for over 7 years, and before working on platform solutions, helped define and execute Medullan's lean digital strategy, and before that, the agile development offering that we have in the market. So just a little bit about Medullan, and then we'll move right into the content. At Medullan, we are digital health experts, which means that your world, the business challenges that you face, the healthcare problems that you all are trying to solve, and why we do this, well, that's our world too. Right? We do this because as a company we believe that health matters. So we leverage our digital platform and service offering to help organizations bring solutions to life, not only just to do it, but also focused on bringing things to market that people will use and adopt. So that's what we do here at Medullan. All right, and without further ado, let's move on to what we want to get out of today. So by the end of this very short webinar, we would like each of you to walk away with at least 3 things. The first is a baseline understanding of why at least we believe personalization matters, and why personalized experiences are so key to engaging members. The second is having an understanding of key program, process, and people components needed to deliver these experiences, right? So that's a lot about the how. How could you within your organization begin to organize in a way which enables you to deliver these experiences to your members. And then finally, we'll close by providing you with a measurement system that you can use to compare how committed your organization is to engagement and engaging your members, and compare yourself against other folks in their organizations that are on the line today. Okay? So without further ado, personalization and how important it is to engagement. First, you'll hear a lot from us in all of our discussions. We start with talking about people, who they are, what they need, and how we can help them. So today we're going to talk a lot about Ben. And Ben is a 42-year-old working as an independent contractor, but really just getting by. Okay? He was recently diagnosed with asthma, and he's not a real habitual person. So when he heard from his doctor upon diagnosis of having to stick to this daily or weekly regimen of use of a long-term bronchodilator treatment, it worried him. But on the other hand, he's stubborn, right? And he doesn't want to be a statistic. He doesn't want to be one of those 55% of people with asthma who take too little medication or none at all. And he certainly doesn't want to be one that, as a result, progresses to a more severe disease. On the other side, to lay this out, we'll talk about Ben's health plan, and that's Wellbridge. He qualifies for federally subsidized health care, and Wellbridge provides that coverage. They're a regional commercial plan with a sizable Medicaid population. And what both Wellbridge and Ben have in common is this desire to have Ben adhere to his asthma medication, right? Wellbridge is also measured, right, on their ability to help Ben. And in this case, we'll focus a bit today on the HEDIS score around asthma and asthmatic population of a health plan. HEDIS being healthcare effectiveness data and information set used by CMS to measure the quality of certain services that are provided to members. The other thing that Wellbridge knows, and their team members know, is just how important creating a connection with a member is, right? Especially someone in a situation like Ben's where they've just been diagnosed, because building a relationship at that point in time and showing members the value that Wellbridge can deliver is a very important time for both the plan and the member. But this interaction, this need to connect, well, it can be done well, but we also know it can be done not so well. So that'll be our next step here. Let's kind of look at a situation that may not be the best kind of implementation of an engagement strategy and personalized experience. So first we want to focus on a specific behavior, which is this prescription pickup, right? So continuing with Ben's story, this interaction or this behavior is what Wellbridge in this case is looking to support, right? You can also see if you click next that there is this multitude and broad set of contact channels that Wellbridge is bringing to the table. These capabilities, these touch points, they often come to life within a health plan through like siloed initiatives, right? But sometimes these initiatives are not always coordinated. So at this moment, you can see there's no real centralized or no method to the madness of use of these channels. And as a result, no holistic view of how the plan should perform outreach to Ben. Secondly, the result is, as well, is the fact that there's been no input from Ben. So Wellbridge in this scenario really has no idea of what Ben's preferences are. And the result is this impersonal experience. There's no alignment of touch points. There's no real focus and centralization around this key objective of supporting him and the reminder of medication adherence there on the 28th. There's no continuity of communication across those channels. And as a result of no input from Ben, no real learning about what's working and what is not. So although you can see the phone message reminder happening on the Monday before the prescription pickup is intended to occur, the health plan, in this case Wellbridge, they don't know that Ben is not necessarily open to phone calls on Mondays because he works late. And in general, his personality is not one to pick up a phone call from a number he's not familiar with. So in that case, he just doesn't listen to the message. The result here is an experience that leaves Ben confused, really. He has this myriad of different touch points coming at him from different parts of the organization, and there's no real cohesive feel. And as a result, Wellbridge runs this risk of not taking advantage of this opportunity where Ben is open to help, and instead actually creating decision fatigue and losing Ben's trust as a potential supporter in this journey. So let's take a look at it from a different perspective. What if we started with a scenario where Wellbridge had a strategy in place to collect contact preferences? And this can be done either during online registration, campaign during login or password reset, or let's say along with a coordinated go paperless campaign for certain communications. With this information of preferred contact methods, Wellbridge can begin a path to a personalized experience for Ben. Add to this a level of coordination internally around these different member touchpoints and interactions in a coordinated view, and you get a scenario where Wellbridge can really develop a communication calendar. One that first aligns to Ben's preferences. We've now learned that email and chat are preferred, but also coordinated communication, which enables the creation of these weekly digests you see on Sundays, where we have learned Ben actually opens an email when it's on a Sunday because he looks at email on Sunday afternoons, as well as seeing that he utilizes chat as his kind of transactional way to communicate with the health plan. In this case, you can also see on the Friday prior to his prescription pickup, Ben chatted asking about a recent copay, and the CSR was able to, with a cross-channel context, demonstrate the awareness that they have of that prescription fulfillment need and reminds Ben of that upcoming action to take. So this experience with a focus on that key measure of the prescription pickup, but the cross-channel communication, the organization, and coordinated touchpoint schedule really increases the member's willingness to engage with you as a plan, with personalized experiences really requiring that integrated effort across the org. But we know that personalization is not just preferred preferences, right? So let's kind of break down how we see or we define personalization, the key components. We first start with arguably the most important one, which is relevant information. And this is really everything that we know and can learn about our members, considering healthcare related things such as health status, health history, but also other things that impact health, lifestyle, behavior, motivations, and goals. And of course, now lots of population health and engagement platforms are using non-health related data to begin to infer things about members to help develop smarter predictive measures. But really capturing what you know and creating a 360 view of the member being that first and most important point. Another important point is understanding that you are, or ensuring that your customer understanding evolves. And in order to do that, you need to maintain engagement and have a strategy to continue to collect information from your patient in addition to just what you have access to, claims and prescription claims, to understand how their journey, their healthcare journey needs are changing over time, right? And how the things that affect their health are changing over time. So the other side of this coin around relevant information is, what are you doing with that, what you know about your member, right? So how are you presenting to members, based on what you know, the personalized copy, messaging, and calls to action that will get individuals to act? Starting with the segmentation of individuals based on what we know is a great starting point, but now folks are getting even more, or having a requirement around a more unique approach based on what we have captured around needs and preferences, and putting those two things together is the best, or increases your likelihood, or the likelihood of your member to engage overall. We've talked a lot about communication preferences, so I won't go too much further into that, and instead move over to preferred time, right? The right time. And this can have a couple of dimensions. But the one I'll focus on is this evolution statement that I referred to earlier, where we find engagement strategy and experiences that have to differ and follow a member along their overall journey, depending on where the member is in their overall health and their health care. Ben's example is a good one, where we're focused on that time after diagnosis and early in treatment, where individuals are very often open to making a change and are looking for support, looking for information. How do I deal with what has just come and has impacted my life? And especially when habit creation is key as well at this time. So that's where we are, but then we need to graduate along with Ben to move from this early kind of treatment habit form to that regular maintenance mode, where we know Ben will need that nudge and support to keep him going on his treatment, as well as where we know that Ben will need to see proof, right? Proof that all of the effort that he's putting in is paying off. So why does all of this matter, right? I mean, what do these techniques do that helps increase the likelihood that Ben will engage? And we know, based on studies that have been done, I'll reference one here specifically from the University of Texas, which distills all of this down into two key things. And the first is that personalization makes us feel like we're in control, because what you're interfacing with is something that's specific to you. And although a member is not actually deciding what content or copy is being presented to them, just the perception that the member's in control increases, and this is as people, increases our interest in the content and our confidence to take action. The second is the perception of information overload, and that this personalization is reducing the amount of information that I have to deal with in order to make a decision. So think about it. You're given an email that references recommendations that you see is based specifically on an element from your health history. So you'll believe that other recommendations that are not specific to you have already been parsed out. So with this perception of less information overload, members have more confidence in the options that are there and are able to create a framework to make a decision. And this is what the science tells us, is that there's a much higher rate of being able to make a decision when that framework is in place. And all of this really culminates into helping members and people take action, right, and make it easier to do the right thing. And if you as a plan are able to show the benefit of taking action with you as the plan routinely, well then you're on your way to having a more engaged member. And it's so important, right? Because we're, as an example, in retail, this additional engagement may result in buying another widget. In healthcare, we're literally talking about a more engaged patient being, one with improved health outcomes, and potentially we're talking about saving lives. And improved health outcomes do not only benefit the member, of course, the benefits to your organization and aligning this to your organization's needs are just as important. So a healthier member and a more engaged member can, one, have a significant impact on increased satisfaction with the plan and the likelihood to stay, willingness to stay and refer, as well as increased quality metrics, which we'll talk about more, resulting in reimbursement increases, specifically around HEDIS for folks utilizing CMS as a payer. And finally, with a healthier population, overall, you see less use of utilization of the healthcare system, resulting in lower costs and overall kind of medical cost management, which is often a key metric for plans. So I know you're saying, okay, that's all great, well and good, but where do I start, Ryan? How do I start going with this? And we like to say that you have to start by defining exactly what you're trying to measure. And this begins with how you measure yourself. What's your purpose, what's your vision and your strategy, and how are you measuring your organization's capability to deliver on that? So under the strategy, we typically have a set of key success measures, right? And this is how you kind of break down everything that you do within your organization to realize your PV and strategy. We'll focus on specifically quality metrics here. If we go back up to the example in HEDIS, but this is where we actually bring it back down to the member. So once we have our kind of umbrella, how we measure our organization, with every initiative that we do, we then start with what's the behavior that we want to affect. If you remember with Ben, this is about adherence to prescriptions and script fulfillment, right? And then what's important is to be able to create a line of sight between that behavior we want to affect and the organization's overall success measures. So here there's a specific HEDIS measure for asthmatics in fulfilling the percent of those within the asthmatic population of a plan that fulfill their prescription at 50% and then on 75%. And so this aligns to HEDIS and right up to your quality measures. So the point is, begin with what you measure and create line of sight between that behavior and how it impacts your business's KPIs, right? So that's where you start, and now Meg is going to talk about how you take that alignment and bring it into your actual organization operation.
Thanks, Ryan. So in thinking about what it means within an organization to engage members, we often focus so much on the channels and the communication strategies in place, which, while very worthwhile, unless we're aligned internally, it becomes increasingly hard to execute or deploy those engagement strategies. So we really want to start and focus on internal alignment in order to produce those types of personalized experiences for members that will really be most impactful to them. So I'm going to walk through a couple of stakeholders, and these people and the way that they work within the organization may resonate with some of you in terms of the roles that you currently fill or the people that you work with. So I'll start with Zoe, who is a business analyst on the clinical team. And as a business analyst, it's on Zoe to work effectively to create engaging strategies for members, especially around new programs. And in this case, in thinking about the example of Ben, Wellbridge really wants to share a new incentive program for Ben that's related to medication adherence for asthmatics. But Zoe doesn't know necessarily how to get started. So especially when it comes to digital and non-digital forms of engagement, Zoe's been much more focused on the day-to-day business and problems, essentially, that the clinical team has. So when it comes to engagement or outreach, that may not be her area of expertise. And Zoe reports to someone like Danielle, who would be the clinical team leader and very much responsible for the communications quality and alignment to business KPIs, as well as quality standards that the organization has for things like HEDIS, and in the case of this asthmatics incentive program, something to make sure it aligns to the requirements of HEDIS. But she also has to report that back to senior leaders in the organization. So as a senior leader herself, other leaders in the organization would be looking to Danielle to hear how engagements are doing and the success or lessons learned of some of those engagement strategies. And Danielle and Zoe would be working with someone like Alex, who's a communication specialist on a digital team. And digital team can be thought of also as an engagement team, a communications team, or a member outreach team. But essentially their role would be to communicate to internal stakeholders how to effectively reach out to members and what the channels are to be used in outreach strategies or engagement strategies. But often Alex finds himself caught between stakeholder groups. So it might be the clinical team, or it may be other teams within the organization where Alex is trying to set realistic expectations, which is often hard to do as there's not always a centralized repository of these schedules, or there isn't an effective communications process internally to ensure that these different stakeholder groups are aligned on what the expectation should be for when and where and how that member outreach occurs. So in thinking about these three stakeholders specifically, Zoe, Danielle, and Alex, what would alignment look like for them or for you within your organization if this starts to sound familiar about these different stakeholders? And to start, we would really come back to Ben. So as Ryan mentioned earlier, with both the member need, obviously, in improving those health outcomes, we understand that there's also an aligned business need. With this eventual goal of relating that back to not only what we're trying to define what we're measuring, but also having that be impactful against our business KPIs. So from there, we would have someone like Zoe submit an initial engagement design. And this would require that Zoe really understands what engagement is within the organization. So perhaps training or consistent standards for engagement within the organization. And we'll talk about in a little bit some ways to get started with that. But ultimately sharing that content and that strategy with her boss, Danielle. Obviously, we know it's on Danielle to ensure that the clinical terminology and any requirements for Ben within that engagement strategy need to be in line with HEDIS as well as other quality measures that the organization has. And from there, perhaps in a centralized repository or in a clear identified process that the organization has on submitting these types of engagement strategies or proposals to the digital team or engagement team, a person like Alex would then deploy it based on overall business priorities. So not just focused on the first come, first serve, but very much focused on the year. So if we were thinking in the case of 2017, looking at the business priorities across 2017 to ensure that these types of outreach efforts or engagement efforts are being deployed in line with what the organization is focused on. And then ultimately, even as that engagement strategy is being launched, or at the end of it, these three stakeholders of Alex, Danielle, and Zoe would come back together to review how someone like Ben is engaging with this strategy. What are some things that they could perhaps do differently in the next release of the same strategy, or even in the next version of an incentive program, or even more impactfully, in rethinking benefit designs over the coming year to ensure that they're meeting, again, both member and business needs. So very focused on an iterative process to ensure not only internal alignment, but successful external launches of engagement strategies. So within an organization today, within your organization more specifically, when you say member engagement, what is the most likely response from people in your organization? And this could be within your own stakeholder group, like Zoe and Danielle on the clinical team, or it could be on a team like Alex's, where you're focused on member engagement today and perhaps have your own definition within that group. Or you could just be in a different stakeholder group within the organization that perhaps has some knowledge or awareness. But ultimately, what we do here, and Ryan mentioned this earlier, is we look at a maturity model of how engaged or committed your organization is to member engagement internally. So if we start with unrecognized, so what you may hear when you ask that question of what is member engagement, or member engagement conversations more specifically, something along the lines of, isn't that just a notification or an alert? So this would be pretty unrecognized in the company more broadly. The second would be interested. So there may be a committed team, like Alex's team, that focuses specifically on member outreach, and that is their main purpose, to ensure that both internally the company is aware about member outreach, but externally they're the ones that are releasing these engagement strategies, as well as the communications coming from the organization. The third is invested. So this would be something where that member outreach team or engagement team is sharing knowledge. They are teaching the company about what member engagement is, and they're using different tools internally within the company to ensure that everyone has some level of awareness about what member engagement is and how to do it effectively. The fourth is committed. So an example here would be there's some sort of centralized repository, perhaps SharePoint, where people could actually submit proposals for member engagement strategies or outreach. But they're only doing that about half the time. So half the time they're submitting to SharePoint, the other half the time they're emailing their contact on the inside, or that one friend they have on the engagement or member outreach team. Engaged is where leaders have buy-in into this process. And here we see an example of a clinical team leader, so like Danielle, who ensures that engagement strategy is a core focus in the onboarding process of her team. And lastly, embedded. So this would be an example of where the goals of an engagement strategy are shared across an organization, from the leadership all the way down to perhaps the business analysts at the Zoe level, but where things like benefit design actually change based on the metrics and reporting that have been received in previous engagements. So this would really be an example of that iterative process that we saw on the previous slide. So now we're going to actually ask you all to answer that question of, when you think about member engagement in your company today, where does your organization stand? And we'll give just a couple, probably give 30 seconds to a minute to ask people to answer this question. Great. And looking at the answers here, it seems that most people are in the interested category. So this means that people feel like this is something that there's a committed team to, but not necessarily invested or truly engaged within the organization. So we'd like to talk to you a little bit about what can come next for your organization to get to that point where it is truly engaged and embedded within your organization. So how do we get there? So with this understanding from what Ryan shared around creating personalized experiences, and now also seeing how internally within our organization we can ensure that cross-company, all of these stakeholder groups have an alignment on what engagement is, there's a couple of key plays. And we call them plays specifically because it's about tactics and strategies that you can deploy and refine based on testing over time. And we use something called the Healthcare Engagement Playbook. And to start, this really begins with looking internally within your organization. So look at your existing workflow. And this gets into when we think about Alex and Danielle and Zoe and how they were working together. To date, it might be something that's quite fractured and not necessarily cohesive, causing a lot of different hallway conversations and bumps in the road for both Zoe and Danielle, and trying to effectively reach Alex and seeing, what does essentially their knowledge base today bring to someone like Alex, but on the other side, what can Alex do to ensure that he's working effectively on scheduling these types of member outreach and engagement strategies? Second, focusing on the data. So adopting a data-driven approach really means that you're understanding the metrics that are coming back from your members who are engaging in existing strategies. And this really comes into understanding your foundation. So that baseline of what existing channels and tools your organization has in order to create that data-driven approach to craft personalized engagement and experiences for members. And lastly, as we were talking about plays, adopting a lean mindset. So what this really means is failing fast and succeeding faster. And this is a low-cost, highly effective way to learn more about your members, but also to create plays that essentially work across the organization, regardless of the type of engagement strategy you are looking to deploy. And if you're interested in seeing more plays, we do have the engagement playbook available today for downloading. So you can download it both off our website, and I believe it will also be sent out after this webinar with the content from today. And again, this is just another series of plays to keep in mind when starting to craft and plan engagement strategies externally, but also things to think about internally within your organization to be at your most effective for deploying these types of strategies.
Great, thanks so much, Meg. So I just wanted to close by saying thanks so much. But before we do that, let folks know that Medullan is heading to HIMSS. We're heading to Orlando next week, and if anyone would like to connect next week, we would be happy to do so. So please reach out at either ask@medullan.com or on the next slide, you can actually see our private, our Twitter and email addresses. So rrossier@medullan.com or mberke@medullan.com, or check us out on other social media. So thanks again for your time today. Since we're running up on time, we will take all the questions that you've asked throughout the webinar and get back to you individually with responses. So thanks again. Look forward to seeing some of you next week in Orlando, and look forward to seeing future Medullan webinars. Take care.